Have you always been wanting to work in the medical field, or you always want to be at a hospital and you've been dreaming of becoming a doctor or to even work as a doctor, but you don't know the kind of course you have to do for you to render your medical assistance or your medical care to the patients that you mostly think about. Today we are going to look at one program in the medical field that is very very important, and because of the narrow gates to medical schools or to medicine, it is very important, and it is very necessary for us to look at another option that students normally use when they want to go into medical school. They normally apply for physician assistantship or physician assistant. This is a program at the university that is really really helping a lot of students who have been wanting to go into the medical field, but they couldn't get opportunity to go to medical school or to pursue medicine at the university to become medical doctors. So most of them decided to take this course and then work with doctors, and as time goes on they go into medical school or to pursue medicine, then they will become the doctors they've been dreaming of becoming. So today we are going to look at physician assistant, and we look at the job opportunities we have within and what physician assistant is going to do when he's out. In fact, this program is a 4-year degree program because it is in Ghana, but in some countries you have like 2 years or 3 years depending on the country that you are living in or you are going to have or going to pursue the degree. So that depends on you. But for Ghana, you are going to take it for 4 years, and let's look at some of the things you are going to do. As a physician assistant, you don't need to do a lot of things and autonomously, like you don't need to do a lot of things on your own. We have things within your range that you can do, and we also have things that you can't do. So there are basically some things that you need to do, of which one is history and physicals. History and physicals, diagnosis, interpreting labs, interpreting lab results, and then some basic procedures. Yeah, particularly as the name goes, assistantship. So you're actually assisting a surgeon, a doctor, a cardiologist, a neurologist, whoever it's in the medical field that the person wants your assistance. In fact, you are working there to support them, despite the fact that you sometimes render medical care or hospital care to your patient. You still need to work with a doctor or with physician so that your work will be supervised by that particular doctor, and sometimes too your decisions are going to be changed based on their experiences, because it assumes that you don't have the requisite knowledge to do a lot of things on your own. Not that you are not well equipped, but because of the experiences that you may be lacking. Alright. So the assistantship do common things like history and physicals, like asking of what's happening with the person or how it started, how he's now coming to check up, how he's now feeling and other stuff. So it's all about knowing about the patient, what is happening to the system, and then getting to know her. You diagnose, then you go to lab to interpret the results, then you move on to basic procedures in the hospital or in the medical care. So you can do all these things, but you are basically helping a practitioner, or let me say a medical doctor or a surgeon or even a physician. So you are probably going to be under supervision. However, your work is not going to be loaded as the medical doctor or the surgeon or the physician that you'll be working under, because you have a lot of opportunities. After closing for 6 p.m. or 8 p.m., you are good to go. But a doctor can easily be called at any time within the day. So you have opportunity over there. But as you are getting to know the physician assistant work, let's get to know some of the qualifications that you need to have to pursue this program. Um, Mostly I start with WASI candidate. But today I'm going to start with some exceptional candidates that they can also apply. These candidates with a bachelor degree or first degree can go into level 200 or 300. If you have a Bachelor of Science in nursing, yeah, I've done a video on that, so you can check it. Bachelor of Science General Nursing, that's what I think I did on. So you can check it. If you have this degree, you can go and apply, and then you go for level 300 based on your interview and your experiences that you have. And if you're also having a degree in sciences, biological sciences, biochemistry, medical laboratory technology, all these people, like those having degrees in biological science or yes, anything related to biology and science and healthcare, can also apply, and they can probably be admitted in level 200 provided they pass their interview and other stuff. If you're also a mature applicant, you must be at the age of 25 at the time of applying, and you must be a registered nurse for at least 3 year working experience so that you can apply for this program. Now, if you're also an SHS applicant, normally medical schools or science related courses admit science students or those students who have degrees or have certificates in sciences. So probably you are going to have your science, your biology, chemistry, physics, and the elective maths. Alright, this is what you are going to have as a WASI candidate plus your core subjects. And if you want to go to KNOST, it is at grade 8. Yeah, so never think you are going to take it so easy. So science students should be careful and learn so hard that they will be admitted, because KNOST particularly has one of the largest applicants per year. So provided you have a lot of people applying for medicine and physician assistant, so you have to get a better grade, like that's the cutoff point. So make sure that you get a better grade over there, and then you make sure that you also pass your electives and you pass your core subject as well. If you're also an A-level applicant, you must make sure that you have credit passes in your O-level, including English and Maths, and you must also have a biology, chemistry, and physics in your A-level where passed, so that you can also apply. If you're also an O-level applicant, after your first 5 credit passes in your O-level, you must have a better results in your WASI as well as your SSC. Either WASI or SSC, depending on what you've written. So that is that for physician assistants and those who qualify. So that's for KNOST Kumasi campus for you. So friends, my name is Augustine Esielu. If you are a returning viewer, I appreciate your effort for keeping this channel going. If you're also a new subscriber, I apologize and I say that let's keep in touch and let's be in touch and let's keep this channel going. Introduce your friends to this channel and subscribe to the channel and make it successful for me, because you are going to make it successful. So consider subscribing and liking so that we can continue this. All right, thank you. See you next time.